Hello, I'm Jeremy Barker, the director of the Middle East Action Team for the Religious Freedom Institute. The mission of the Religious Freedom Institute is to achieve a broad acceptance of religious liberty as a fundamental human right, the cornerstone of a successful society, and a valuable contributor to national and international security. Today, I have joining me from Erbil, Dr. Nemam Ghafouri, the founder of Joint Help for Kurdistan, a nonprofit organization working in Iraq and Syria with local doctors and nurses, as well as volunteers from all around the world. Joint Help was started in August 2014 in response to the genocide that had happened in Iraq, and continues to work with refugees and internally displaced people in the region. So Dr. Ghafouri, thank you so much for joining me today from Erbil.
Thank you for having me.
It's our privilege. So in this series of interviews, we're just trying to understand better the impact of this COVID-19 crisis on different communities across the Middle East. So from your experience these last few weeks in the north of Iraq, how has the COVID-19 crisis impacted Iraq over these past few weeks?
Actually, it has, what can I say? It's like a coin. It has got two sides. In one side, because of the lockdown and total curfew, it made it possible to have a great control over COVID-19. And in the past 7 days in the whole region, there hasn't been any new cases. And also in Erbil and Suleimani area, in the past 2-3 days, there haven't been any cases. In total, in Kurdistan region, there has been 337, only 4 deaths, and there are only 22 people who are still in hospital and not recovered. So in that sense, it has been really, really good. But at the same time, for people, it has been a disaster because, especially for those who are still living in the camps, in the whole region, we have 21 camps. 4 are for refugees from Syria, and the rest are for IDPs, internally displaced people, especially for Yazidis, because still till today we have more than 300,000 Yazidis who are still living in the camps. And these people, they don't have any income. And most of them are very dependent on agriculture at this time of the year to go and work as a employee for those who have big lands, or to rent a piece of land and start, planting vegetables and whatever. It's the kind of seeds for the year, so they have an income. But this all been stopped because of corona, and at the same time because of total lockdown between Kurdistan region and South Iraq, and also Shingal. So people have been separated from their families. And even this has been really pressuring many people, because there have been families who left to Shingal for taking back their dead one, because they don't want to have any graveyard in Kurdistan. They will take them back to Shingal, especially to Sherfadin area. And they have been stuck, and their children are still in the camp. So it has affected in a very bad way. And on the top of this, except for the lockdown and prohibition of coming out, there hasn't been done anything for the camps, I can give you a couple of the examples. 3-4 weeks ago, because of because of bad cables and the thundery rain, so we had fires in 8 tents, which is, each tent is divided between 2 families. and they were totally, burned down to ashes. And it was really dangerous because many of these people, they are working either as Peshmerga or police or as a soldier in Iraqi army, and they bring back with them their weapon to the tent. So that night, it was really like a front line. It was
Wow.
just a miracle. Nobody was injured. Until today, they haven't repaired those tents, and the families in those tents are living with the other already overcrowded, relatives in the camp. And when you say COVID-19, you have to have the distance. This does not exist in the camp.
Yeah.
So there hasn't done any planning or any prevention more than, just the recommendation that is told, but it's not implementable in the camp where you have a family of 10 or 15 under one tent, which is only 3x4 meters.
Yeah. Yeah. That's a reality of just the really challenging situation these communities face. How has this impacted the behaviors or practices for these communities? For the Yazidi in particular, this was the time of the New Year, which is both a cultural and a religious festival. So how have behaviors or practices changed in these last few weeks?
I must say I was really impressed and surprised by the great response that these people did, and really respected the danger of COVID-19. So they were really sad, and also in general, what I have seen, they are more depressed than before, and their hopelessness, it's even worse now than before. It's like, that there is no way back, no way forwards. So, and in March we had 3 suicides. One of them a young 19 years old girl in my camp, and the other 2 we knew them also, but it was in another camps. And already now in April, we have had 4 suicides among these people. So it has affected in mentally in a really stressful situation. At the same time, they have followed, the instructions, and despite the difficult situation under the tent, they have kept themselves actually under the tent. And in the New Year, which was Çarşamba Suri, the last Wednesday, hardly anybody was out.
Yeah.
In the camps.
Yeah. And I think you've done a good job of highlighting that this COVID-19 crisis, it's not just a public health issue, but it's had economic impacts, it's had mental health impacts on these communities. And so we have to look at all of those different dimensions as we consider how we respond to that.
I would like to add one more thing. Instead of, thinking about the people, the Iraqi migration and displacement ministry, for 3 times in a row, they have sent, poisonous food to the camp. I have filmed the food packages. There are rats in them, or they are half eaten by rats, So instead of being more taking care of people in that situation, when they don't have food to eat, when they don't have money to buy, when they cannot go out anywhere, on the top of everything, they have been given, polluted food packages, which is it was either half eaten by rats, or there was live rats in them.
Wow. Well, that brings me, I think, in a really sad way to this last question of what are the things that local governments, NGOs, international organizations can be doing to more effectively help these communities during the crisis?
I think there is only one thing that could be, effective. And this is the donors who are giving support to Iraqi government to help these people, or donors who are giving money to UN and WHO to help these people, to make it conditional, because nobody knows where this money are going. If you look in the past 6 years, what huge amount of money have been sent to Iraq to help these IDPs and refugees. By this, you would have rebuilt the entire Iraq by now.
Yeah.
Where did all this money went? For our organization, if people are giving me $1 or $10 or $1,000, they always ask me for receipts, for documentation. And I don't understand why for the big organization, it's not the same.
Yeah. I think that leads to, this important point of accountability and not measuring things only by the dollar amount spent, but on the outcomes for the people involved. And that's what humanitarian assistance is really directed to, is people and improving their outcomes.
Exactly. Yeah.
So, well, thank you so much for joining me today from Erbil. Any last points that you would like to highlight?
Well, yes, it's about the women. I'm sure that you have read in the developed countries and in Europe and North America, due to COVID-19, we have seen more violence at home, domestic violence. So imagine if in developed countries is like that, where people are living in a normal houses, or at least compared to the camp, in a better situation. In the camps, it's even worse.
Yeah.
And on the top of this, for IDPs and for Yazidi women, it's double worse, because they are survivors. And they have very much difficulties in many ways, mentally, psychologically, and physically. And this COVID-19 has been a much, much, much bigger burden on them, because they haven't been able even to make a phone call with some privacy.
Yeah.
They are not even, given this chance. So thinking about the women and their situation in a closed, situation as under the lockdown of COVID-19 is, or it has been my priority number one all the time during this time. And this should be for any others also.
Absolutely. Thank you so much. Thank you for the work that you're doing there in the north of Iraq with these communities. And please do stay safe. Thank you for joining us to share more about this.
Thank you so much. Stay safe and healthy.
Thank you very much. To learn more about the Religious Freedom Institute, visit us online at www.rfi.org. Thank you very much.